Speaking to you about the Black Men's Health Clinic. I think the last time I spoke before you was in December, as we kind of walked through what the plan was for the community outreach funds that were designated by the Board of Managers. We did provide a Q1 update to the executive staff as part of our regular meetings with them as we share information. And so now today, I'm going to share with you sort of year to date where we are in regards to the Black Men's Health Clinic. There is one caveat. I'm going to be concentrating primarily on what is happening within the community care clinic that is operating out of there, and specifically as well as the community outreach activities that are funded by Central Health. I'm going to leave all the other good work that clinic is doing to them to speak on their behalf and better describe the full suite of services that they are offering out of there. Next slide. So just as a refresher for you all, the Black Men's Health Clinic, which is a separate nonprofit, opened in Q2 of 2022 in March. We were in discussions with them previous to opening around what it might look like. They really envisioned a different model of care that really focused on the health needs of men of color. The board of directors recommended that we add BMHC to our HRSA scope of service, which means that it is official site within our 330 grant. At that point, it's 1 day a week, but that allowed us to go ahead and open and start providing services while keeping an eye on the demand. We started delivering services officially in June, and the Board of Managers voted to allocate $290,000 to community care to assist with personnel at BMHC related to community outreach, specifically with under-resourced individuals within Eastern Travis County, men in need of healthcare. Sorry, I am skipping around, going up and down is hard. We're able to hire a provider in Q2 of 2023 that we share at Runberg, and then the 1 day a week at the Black Men's Health Clinic. We did expand to 1 full day instead of the evening hours. Part of that, I think, as I mentioned to you before, was at the request of the patients themselves, and is something we continue to keep an eye on. The nice thing about sharing that provider is that Runberg is close, and that if there are procedures or services that cannot be provided in that smaller environment at BMHC, we are able to preserve continuity of care with the provider at Runberg if necessary. We have, and you'll see in some of the later slides, that we are still sort of tinkering and iterating on what is the best use of that site and the time that we allot to that clinic. And so we added standby appointments in Q3 to help fill out the schedule in June and mitigate some of the issues we've been seeing with no call rates. Next slide. So clinical progress. Activity in the community care clinic hasn't continued to increase. We've had nearly 375 completed visits, with 75 of those occurring in May and June. Some things to note: we have a handful of legally female or female at birth patients who are accessing the clinic that started about 2 months ago. Anecdotally, the team members say that these are spouses and partners of male patients. The team has developed scripting when people call in to make an appointment. We make the intent of the clinic known, but we are not screening out and refusing to schedule to turn female patients away. It's something we will continue to keep an eye on. And just for your information, primary diagnosis at visits track really, really closely with that health profile that we presented to you back in December of the health needs of men of color, and that's hypertension, high cholesterol, diabetes, and chronic pain. There are many more issues than that, but those are sort of the bolus of issues that we are seeing and being treated and diagnosed at the clinic. Next slide. So when we talk about no call, no show rates, this is different than cancellations. This is folks who just don't show up, and you can sort of see the trends over time. The good news, as you can see, is that we continue to increase the number of completed visits, which is the goal. But our no-show rates at the Black Men's Health Clinic is higher than what we typically see at our other sites. Right now, it is unclear if the driver for this is transportation, the location of the clinic, or the limited availability of appointment days. As I mentioned on the earlier slide, we did try scheduling standby patients, making it clear that they were not guaranteed an appointment and would need to wait to test demand. And that does appear within early results have been successful. We will continue to monitor as we determine when and how to add that second day of clinic. Next slide. And so just in terms of the demographics, you'll see here that the largest zip code that is served out of the site is 78753. That's Runberg, both on the near west side of I-35 and east of 35. That is our highest patient population overall for the system in terms of density of patients. But the other zip codes where patients are coming from are certainly some of our highest needs areas and track very closely with the Eastern Crescent. And again, here's the slide, the chart that kind of shows how we're doing in terms of gender of patients and that very small slice of female patients that we saw in May and June. Next slide. So the majority of the patients that community care is seeing are uninsured, including our Central Health MAP Basic covered patients. You'll see here that MAP Basic patients make up the largest and fastest growing proportion of patients. Self-pay is second, depending on the month. The others are filled in with some of the limited third-party payers that we have, as well as Medicaid and TRICARE. And other would be other insurances, by and large. Next slide. So we talked, I think in December, a little bit about the name of Black Men's Health Clinic and making it clear that this was really a place where men of color should be comfortable in seeking and receiving care. And so I just wanted to break out for you sort of the demographic by the patient and ethnic group and patient race that we're seeing. That yes, by and large, the greatest proportion are Black and African American men, but there is a sizable Hispanic and Latino population that is also utilizing the clinic. 20 of the visits, just of note, were by white non-Latinos. And so we are getting that traction while keeping the uninsured, low-income focus across men of all races, but preponderance of men of color. Next slide. So specifically to the Central Health funded outreach activities, year to date, the Black Men's Health Clinic in partnership with Community Care, they have invoiced us for about $160,000. We did get a bit of a slow start in terms of just the fiscal year that we were not able to contract them with them until we had hammered out what the actual community engagement strategy would look like. They were able to get up and running beginning in January, and the group is on pace to expend approximately $286,000 by year end at their current levels. One difference, I think when we talked in December, we talked about specific positions. BMHC also uses contract employees with groups including Hungry Hill, which they have agreements with, so that rather than hiring the individuals directly, they've spread the personnel across more individuals. That has really allowed them to staff many more outreach events than they probably would have been able to do with full-time staff. So they staffed more than 250 outreach events since January, including pop-up street outreach, events at Houston Tillotson University, Manami events, Manor ISD, as well as other school districts, Juneteenth, community sporting events, church events, and Goodwill Central Texas. Another need that was identified as part of the presentation and the need for the program coordinator was to help them build the infrastructure to compete for grant funding. The organization has successfully competed for outside grants this year, in addition to central health funding, including St. David's Foundation, Austin Public Health, and Austin Echo. Next slide. And so that really summarizes the activities to date at the Blackman's Health Clinic, and Jason and I are both available to you for questions regarding any parts of our presentation.
Well, thank you both for the presentation and for the work you do. And I hope you feel better there, and hopefully we'll see you in person soon. I had a comment, Jason, more. We as a board, I will really interested in collaborating more with your board. And we did have an opportunity last year, or it might have been prior COVID, that we had a working work group where we interacted with your board. So our message to you, if we can have something similar perhaps after our budget season or in the works, because I think it would be helpful to have these open conversations as a board, and we're actually striving for the same cause, is really improving the well-being of our most vulnerable in this community. So that is really something that a message that you can pass. And we thank you all for the work you do. And at this moment, I am going to open the floor for any questions. Manager Jones.
Thanks for the presentation. Very informative, very helpful, and means a whole lot. I also would like to acknowledge and see if possible, we have Dr. Wallace and Mr. Wallace who are here with us, maybe to come and talk just briefly about some of the efforts that they have seen in terms of the Black Men's Health Clinic and trying to address those disparities. Is that possible?
Sure.
Oh, we have Mr. Morgan too. I'm sorry, I didn't see you there. Briefly, because we're going to be here to 12 midnight, so we don't want to. But can you sort of bring us up to date on where you are and what efforts you're making to address and get men of color, particularly, and others, to the services that you're providing? And on behalf of this board, I'd like to thank you for what you're doing. It makes a great deal of difference in terms of the disparate conditions we see in the health in our community. So if you could speak to that briefly, I'd appreciate it.
Thank you. And to the Board of Managers, we appreciate you allowing us to be here. I'm Larry Wallace Sr. This is Dr. Larry Wallace Jr., Board Chair, and this is Cameron Morgan. He's the Director of Outreach. And so we're very pleased to be here. We're not going to take a lot of time because I know you're going to be here a long time. But we appreciate the support that we've gotten from Jason and his team at Community Care. We couldn't be where we are without them. And we also appreciate the support from Central Health, because when you look at all the outreach efforts that we've made, it's because of your contribution. And we provided just a few slides for you to really look at. And it's not a lot there, but at least you have a chance to see the outreach events, get an idea of what kind of events our team is attending, and also the places where we end up going. And there's also some information, and Tara already talked about this, around race and ethnicity of our clients. And I'm really pleased to know that even though the name says Black Men Health Clinic, everybody is welcome. And almost 35% of the men are Hispanic. And so I know people were concerned, but we believe our services are so open that everybody feels welcome. And what I find out, it's not the label that matters, it's how you treat people. And when people come into our space, they are treated well. There's also gender, no surprise, most of our clients are African Americans. And so basically, our mission remains the same. We work with community care. We have a provider at our place 1 day a week. It's our goal to expand and have more capability. We've had that conversation and we have that commitment. And we believe that with those additional resources, we can be more successful. Our bread and butter is not to duplicate what's already there. It's really to fill that gap and create the awareness. We've done this for 1 year, and we believe we've established a foundation in the community. We have people reaching out to us to say we want to partner with you. Very strong in the faith-based community. In Pflugerville, we were at the meeting last night, and we had an opportunity to talk about a partnership with the Abundant Life Church. They reached out, say, we like what you do, can we help? And so we intend to use some of their folks from their health ministry to help us in our outreach efforts. So the dollars that you provide us are continually being expanded into other areas. So with that, I'm going to stop talking because we have a politician here to my right, former mayor of Manor, Dr. Wallace, and board chair, and I'll let him have a few words. And then I want you to know who Cameron is, and then we'll be done.
Appreciate it. And so definitely to your question, Manager Jones, our outreach and engagement, which Cameron can definitely speak more into, we initially probably really followed the same steps of every other organization, going to the health events, going to regular stuff, and we saw that was not hitting the traction for the targeted population we're trying to reach. We're trying to reach those individuals that have lost the trust, they have lost confidence in the system, that they do not are as receptive to someone that does not look like them. And so from that, just putting regular events together, giving food, giving gift cards and so forth is not going to attract them. So what we shifted to was going to regular community events, Elgin Haggai, Slice of Pflugerville, and other events like that. And that's where we start seeing a lot of the traffic and foot traffic coming in and interest. And Cameron can go into more of, we initially tried door to door. That didn't bring anything. So through his partnerships and his collaborations, sponsoring basketball leagues and bringing in partnerships with Austin Public Health and others to bring in non-intrusively concussion screenings and blood pressure checks for the basketball players before the games. They just did last week with Manor ISD Athletics screenings for the football players. And so we're trying to find these ways of enhancing the organizations and the nonprofits and the other entities that are in the community and really being a part of that community, which we have seen with our numbers. Just this 1 year, we had 100 unduplicated clients that we put down for our report for Austin Public Health. We have almost tripled that. And so just this second year going in, we're going to go back and refocus, making sure that we're giving each one of those 382 unduplicated clients this year the care that we say we're going to give them, because we've already tripled what we thought we were going to have to try to get in, just because of what Larry Sr. said and what Cameron's team has been doing, but has been focusing on addressing the needs of the people, making sure that we unapologetically say that we're here for them. And in that way, unduplicating the effort, we're working with the system in a way of accountability that's mutual, while at the same time improving the system of care for those individuals. Cameron?
Absolutely. And so the key piece to all of that is developing trust. And so the key piece to all of that is developing trust through our efforts. We believe that we want to meet our client demographics where they are. And so by doing that, we try to find areas in the community where trust is already developed. For example, our Healthy Cuts program, where individuals are able to receive healthcare appointments and get $25 off of their haircut. But we know in the community and demographic that we look to serve what the barbershop means to them, sports league and other events. And so not only developing trust through meeting them where they are, but also following up with them, helping with that continuum of care and seeing them through their care plan, and hopefully being a support and a resource to them to help them improve quality of life overall, not only for primary care, but for mental health and also social determinants of health. And so excited to be a part of this and really appreciative for you all and the support and enabling us to do what we do.
And so thanks very much. I'd just like to remind the board that when we look at the mortality and morbidity rates in this community, among our population and the general population, the leading cause of the African-American male population has the lowest life expectancy of any population. And so efforts like this focus in on trying to address that disparity. And we're not going to do it just by talking about it. We have to have people on the ground. And I think this initiative, as supported by Central Health and with the help of community care, is a model that's being looked at not only here, but also around the country to be able to address that disparity. So thanks very much for coming, joining with us today. And I'll leave it at that unless there's other board members that may have any questions.
Thank you, Manager Jones. Thank you all. Any further questions?
Just a comment, and that is to thank you all for the work that you're doing and for the impact you're making on. Since nobody can hear me, right? Thank you for the work that you're doing and for the impact that you're making on your community, our community, because we're all after bringing each other up. Because only as we bring each other up do we improve all our overall quality of life. So thank you very much for what you do.
Thank you, Manager Valdez. Manager Motwane.
I want to echo thanks as well. I also appreciate the detailed report. This is really helpful, both the information that community care shared as well as y'all's report as well. I am so happy to see the growth in patients. So happy to hear the experience and the journey of how you all pivot and adapt, and a little bit of the reasoning behind some of the strategies as you go. It's really inspiring to think of the potential that we have, not only the potential, but of course what's already been realized. Wondering, and I think since it's so early days and really everybody's grassroots at this point, irrespective of where you are in the organization, wondering if y'all are hearing from patients. It sounds like or what I'm seeing on a chart on page 14 of the community care report, it was this one, that showed basically, in each month what the patient coverage was, and I was noticing, and then that y'all had mentioned, of course, that MAP and MAP Basic make up the largest and fastest growing, which is important for us to hear, and to know that our patients are receiving care and receiving culturally competent and comfortable care at the Black Men's Health Clinic. But it also makes me wonder if you all are hearing, or if you have a sense for why more patients may not be enrolled in Medicaid, and why they may be MAP or MAP Basic patients, and whether it's income qualification, whether it's maybe unfamiliarity, whether it's anecdotal or statistical, whatever you're hearing, if you had any insight. But I don't want to belabor that, and that could be for anybody in the room.
No, go ahead. I was going to say regarding the MAP versus the Medicaid, Medicare, we are looking at creating more relationships and being able to provide that information and coordination in our facility. One other discussion was, I know with the previous and the current leadership for Sendero Health Plans, wanting to have those conversations with them as well, to be able to place out all those different resources, foundation communities as well. But we do have that 48%.
So it's probably a sense of like outreach more than really. It's not a trend in the population that folks are not.
Correct.
Okay, thanks.
Correct. Yeah.
That actually helps me.
If I could jump in just a little bit on the Medicaid front, at least I know that the Black Men's Health Clinic sees all ages, but community care is 18 and up. And if you recall, given the fact that we are not a Medicaid expansion state, it is relatively difficult for adults to be on Medicaid.
Yeah, and I think what I would add to that for the Board of Managers awareness as a whole is a staggering 67% of our adult patients that are from 18 to 64 are actually, it's higher than that. It's 71%, 67% is from 18 and above. 18 to 64, 71% of our adults are uninsured, and we know that our men tend to be uninsured longer because they do not get coverage through Medicaid very often. And the main reason behind that is because they are not eligible due to pregnancy, like our women are.
Dr. Martin.
Thank you. Thank you for the very good work you did. I appreciate it. I have a question, two questions, sort of. When you go to recruit patients, say you go to a church, or you mentioned barbershop, for example, is your ability to enroll patients like made available to them there at that moment?
Yes, that was one of the changes we made early on. You can go to events and pass out information and tell people how great you are, but they go away and, they forget it. But right on the spot, we do have the capability of actually making that first appointment.
Great.
So it's real time. And so we find that that's much more effective.
Okay, thank you very much. That's a great answer. And the second one is, what are y'all doing to address the no-show rate? I know that I'm a physician, and that's a real pain. What are y'all, is there a methodology being approached to doing that?
Yes.
Flight 1372 with service for Myers, all passengers.
Hi, this is Tara. I will answer. So the no-call, no-show rate, I would say, is part of our area, although we were working collaboratively with the Black Men's Health Clinic on that. And part of it is understanding the population, which we are endeavoring to do. It's a different location than many of our other sites in the sense that there's not a lot of natural foot traffic like there is in some of our other locations. And so it's strategies like having the standby appointments and other things that our chief operating officer is working on to try and improve that.
And I would
And for
add,
the Board of Managers awareness, across most health centers in the country, the no-call, no-show rate is about 30%. Community care average is about 25%. So while higher by about 14%, we are deploying mitigation strategies, to Tara's point.
Okay, because many clinics, for example, have call the day before processes or send a text message out as a reminder. Y'all doing things like that because the needs tremendous.
Yes, sir.
Okay.
We have those interventions in place. We also overbook. We do same day appointments as well to mitigate those no-call, no-show rates.
Thank y'all.
Thank you.
Of course.
Manager Valdez, is it quick? Because we have another item.
One last observation. I'm an old lady, but I remember the desegregation and busing wars. And we had so many people that were they were teens, they were in high school, and they were not living with their parents. I don't think that has changed. I think I see a lot of that continuing today, and this is 40, 50 years later. So I was wondering whether or not you were making any contacts or having meetings with the transition period from high school to graduation community, where you're making presentations, you're trying to get the kids signed up. Many of them are already 18 or 17 when they're in high school. If you're trying to reach them at that level so that you can hook them into going to your clinic as opposed to someone else's.
Absolutely. So we are making those efforts, working with the local various ISDs, and definitely trying to be as proactive as we can before having to be reactive and make those lifestyle changes before.
Especially with our majority campuses. Thank you.
Thank you all.
And Manager Valdez, I think what we would add from community care's perspective is one of the reasons why we're expanding our school-based health center initiative. We have a health center on the campus of Eakins, and we're looking to expand that. And we already have been selected by Austin Independent School District to operate a clinic on the LVGA campus, and we're working through that as well for your awareness. Thanks again for the opportunity to present this evening, and thanks to your colleagues at Black Men's Health Clinic for the great work they're doing.
Well, thank you all, and safe travels, Jason, and feel well, Tara, and thank you all.
Thank you.
So moving on to